Welcome to our live webinar titled COVID-19 Update, Returning to School. My name is Lee Clark, and I'll be moderating the presentation today. As we get started, I'd like to recognize the generous support of Bristol Myers Squibb and Acceleron, and the generous support of our patients, families, and caregivers for supporting the webinar program today. Due to the high volume of teleconferences on the internet, it is possible you may lose your connection during the program. If you are unable to view the program online, you can call in to hear the audio portion using the call-in number in your reminder email. The program will be archived to our website within 2 to 3 business days. You will be notified by email when it is live and ready for viewing. During the presentation, please feel free to submit your questions at any time. To submit a question or a comment, open the Q&A window in the lower part of your screen. Type in your question in the small text box window, and when you have finished typing, just hit enter. We will do our best to get to everyone's questions today. When asking questions, I do ask that you do 2 things to help me manage the incoming question. Submit your entire question all at the same time. Second, please do not share private health information in your questions. Our speakers cannot answer any specific questions related to your child's personal health care. Our specialists today, we have Taylor Buss, Dr. Rabi Hanna, and Dr. Kate Eshleman, and they are coming to us today from Cleveland Clinic Children's Hospital. So thank you, Dr. Hanna, Dr. Eshleman, and Taylor for joining us today. Dr. Hanna, would you like to go ahead and start off and just talk about in general COVID-19, the vaccine, and how this affects the pediatric population?
Hi, good morning, everyone, and thank you so much for the Aplastic Anemia and the MDS Foundation for having us today. It is really always a celebratory month when we go back to school, and I love to talk about this. And despite we were wishing we are in a better situation as our children and young adults going to school and colleges and universities, or even adults going back to work, the reality it is that we are still in a little bit uncertainty times, but I'm very happy that it is much better than the last year of 2020 overall. So I think one thing that I want to emphasize that it is important to recognize everything we talk about is general, and it need for individual patient to discuss their individual case, how's their immune system, where they are the therapy with their own physician. But patient with aplastic anemia and other bone marrow failure, they are at an increased risk of mortality and morbidity from when they get the SARS-CoV infection or COVID-19. Part of it because their immune system is really unable to fight and clear this infection in a timely and an effective way. Occasionally, we are seeing actually case reports of a prolonged COVID, even if that doesn't lead to a mortality, but it is more complication potentially. But the good news that since last year, there has been amazing advancement in science that enabled us to get really vaccines in a very effective, but in a very safe way. And we have kind of 2 types of vaccines, one category called messenger RNA, including Pfizer and Moderna, and another one that is J&J vaccine. And I'm very excited too that just this Monday, 2 days ago, that the Pfizer vaccine got the full approval of our FDA. So this is a vaccine that has been given for more than 150 to 180 million people. We know a lot about its efficacy. It is highly, highly effective in patients who receive that to prevent severe disease and hospitalization. And we have participated, and there are studies from multiple institutions that show immunocompromised, despite that they can benefit and they benefit from the vaccine, but they are not similar to healthy immune people this was really expected in terms of mounting antibodies, and that's why recently the CDC issued recommendation and guidelines that patient with immunocompromised, that will really include patient with aplastic anemia who are still not in remission, to basically get a third dose or a boost that enable them to get higher protection. So that's really kind of the overall, and what I usually tell our dear families and patients, that start with your disease. If you go back, Lee, to the slides that you showed earlier, I think it is a great summary, and it has wonderful recommendation from the Aplastic Anemia Foundation on their website that tells you if you are in basically in any of aplastic anemia, and I can generalize it to other bone marrow failure, if you are in remission and fully vaccinated, you can go back to school with a normal precaution, assuming that the school is open and the rate of infection is not high in your community. If you are in remission but not fully vaccinated, then it's important to put a mask and use social distancing. I usually do recommend remote work learning if possible until you finish vaccination. Uh, the second category, which is the patient who are still undergoing treatment, if you are fully vaccinated, because the vaccine efficacy and antibodies, it is still may not be fully as the healthy people, we still do recommend mask and social distancing. And if remote working or remote learning could be an option that it is good for you, then would recommend that until you are fully vaccinated. And finally, for patients who have not received the vaccine and they are still undergoing treatment with either cyclosporin, ATG, or other immunosuppressive therapy, I would recommend that remote work and learning, only because they're really at high risk compared to the general population.
Thank you. Dr. Hanna, how does a parent know that their child is fully vaccinated? And how often should that be checked to make sure that they're maintaining protection?
A very good question. I think the definition of fully vaccinated is 2 weeks from the second vaccine for patients who are receiving messenger RNA vaccine. Unfortunately, the antibodies are not very reliable testing at this moment in clinically certified labs. So we do not recommend to test the antibodies. There is no known exact threshold of what it is safe or not. And what we recommend is at least 2 weeks from the second. And I will expand now to saying really the third patient who are immunocompromised should get the third, which is the booster. That way we could say they are fully uh, immunized.
Thank you. And how soon are patients able to receive the booster? Is there like a correct timing that parents should consider getting the booster?
V- Another excellent question. So it's important to recognize that the booster, when the CDC issued that for immunocompromised, did not specify, like similar to what they may hear in the media, the 8 month for the healthy people. For immunocompromised, you could get the booster at around 1 month after your second dose potentially. So that's what they need to go, unless that there is any contraindication or side effect or other thing that happened. 1 month after the second, they can go ahead and get that for the immunocompromised patient.
Thank you. And Dr. Hanna, is there a difference in the susceptibility for patients who, say, have undergone ATG therapy versus a patient who's undergone transplant? Are there different precautions for either population of safety for kids returning to school?
Very good question. So in a transplant, I will start with that because that's really is more uniform and universal recommendation. At least 3 months from the time of the transplant, then you can start your vaccination. The CDC, the ASH, and does not recommend vaccines prior to that. And for that matter, returning to school in our usual return to school recommendation before the 3 months, because that's really is the earliest period for the immune reconstitution and the ability to provide some functional protection against opportunistic infection. For ATG is a little bit different. I think it is because the response of the patient can be different. So it's going to depend on their lymphocyte and their neutrophil that need to be looked into it by their hematologist and decide when they can. But it tend to be shorter period, so maybe around day 60, 70 to day 100, and they can get vaccines at earlier period than what it is for a transplant patient.
Thank you. And we have a question that says, what is the definition of full remission of an aplastic anemia patient? And at what point is a patient at a point in therapy where the vaccine is even an option?
So I'm gonna answer the first question about the remission because I think it is very good. And what we call that hematological response, there is something called complete hematological response, which means that the neutrophil are above 1,500, the hemoglobin is normal, and the platelet above 150. That would be the complete response or remission. Most of the patient may have what's called partial response. It's defined by being a transfusion independent and having a platelet count of really above 50,000, hemoglobin normal or at least above 10. And importantly, what I would, for the sake of vaccines and immune status evaluation, is really the neutrophil being above 1500 and the lymphocyte being in a normal range. That's would be that remission definition in my mind for the guidelines purposes. And if can you repeat the second part of the question, Lee? I didn't
Sure,
catch that.
sure, absolutely. And it says, at what point is a patient at a point in therapy where the vaccine would even be an option?
I think that the vaccine should be an option for patients who are in therapy for are at least got some response. I think if they are still transfusion dependent, the counts are lower than 500. We don't have evidence that it would work, the vaccine, for that, and that's why I would recommend for patients who are on therapy and they have not had response to discuss with their patient, with their provider, if that's valid for them to get it. The concern is really that the vaccine wouldn't work because there is not enough immune system cells to help develop the antibodies that are going to be important for the sustained response, and we don't want to give them false hope of security. The concern is sometimes of this immunocompromised patient, if they got the vaccine early, they may feel that they are protected, and the challenge that it may be they may not. And that's why I still strongly recommend to all my patients to be cautious and to really use social distance if possible and mask. And if they have vaccinated, power to them, and that's great. That's an additional kind of layer of protection. But just with all of these variants that we are seeing and other things around the community, it's important to try to use this other method of protection as much as possible.
Thank you. And this question is for Dr. Eshleman and for Taylor. My third grader has been excited about returning to school, but now we're experiencing some anxiety the closer we get to the date. How can I help her? And how can I help myself because I'm also experiencing anxiety. She is a year and a half out of transplant.
Yeah, great question. Thank you for having us this morning. I think in part our goal is to really acknowledge and validate those concerns. This has been an unprecedented time, and I think a lot of times in a clinical sense, when we think about anxiety, it's based on kind of distorted or irrational thoughts. But given what's going on, there really are no distorted or irrational thoughts. So I think, to really acknowledge and validate and provide the opportunity to talk through that is helpful. And I think seeking the information from your physician about what is safe. This is somebody that you've been in treatment with for an extended period of time, and recognizing that your providers have your best interest in mind and they would not allow you to do something that isn't safe. So I think having that reassurance from a trusted professional, and then finding ways of kind of coping with that distress would be where to start.
Yeah, and to piggyback on that, sometimes if I don't know if she's going to a new school, because you said third grade, and if it was a year and a half, I mean, that's a good chunk of elementary school that she may have missed, maybe even if she needs to go see the school sometimes, because anxiety is future based and trying to figure out what she may be needing to, maybe she needs to see something or meet her teacher prior. Just little simple things like that. But the best thing to do, like Dr. Eshleman said, is just to acknowledge that those emotions are totally valid and real, and talk through those together, and acknowledge and validate that your emotions are valid and real, and you are anxious for her to go back to school too. And there's a lot of different coping mechanisms that we could definitely talk about, different ways to just live in the moment, some mindfulness techniques to just kind of get you through the next few days or weeks prior to school. And then if she needs some accommodations, I don't know what her status is right now, but she may need talking to the school about like a 504 plan. A lot of people are very familiar with an IEP, but may not be familiar with a 504 plan. So if she does need some accommodations to help her through the day, I don't know exactly what's going on, but if she needs extra breaks or something like that, that can be written into like a 504 plan, which may help. Or if she does have anxiety, that's something that can be written into the 504 plan, just an additional break outside of the classroom or something like that. So it might be worth talking to a guidance counselor, or if she doesn't have a guidance counselor at the school, someone in administration, about setting up a 504 planning meeting, which is for, unlike IEPs, the IEPs are for modifications in the education plan. 504 is accommodations. It's kind of how to remember it.
Thank you. And this question again is for Taylor and Dr. Eshleman. My son is in middle school. So middle school can be kind of a rebel stage. And his current school is not requiring mask. However, we are advising him to please wear a mask. He's concerned about standing out and being different than everyone else. Any advice on how we can help him with this?
Yeah, that's tough. Like you said, middle school is a tough age and no one likes to stand out. I think, again, it goes back to validating that his emotions are totally valid, and but also reinforcing that you're doing it out of love and safety. I mean, you unfortunately can't control what he's doing in school at the same time. So I don't have a ton of advice after that, besides like reinforcing the safety behind it, and saying like, yeah, this kind of sucks. I mean, at the end of the day, I'm sorry that you have to do this. And hopefully there's other kids at the school wearing the mask too. But I think it's just also allowing yourself to realize that control what you can. We can't control that he may take that mask off at school, and that Maybe Dr. Eshleman can add a little bit more.
Yeah, I do. Just to reaffirm Taylor's last point, I think a lot of what we do is teaching deep breathing to parents to help them manage these situations. But I think too, helping him, making sure that he understands the reason behind the request. The goal is never to scare anybody with potential consequences. But if he's going to make a choice to wear it or not, he has to know what he's choosing between. And so just making sure that he's well educated on the potential complications or consequences of not doing so. And then I would say trying to call on his peer group, so it seems like, many other kids may not, and they're not probably in the same situation. That said, I suspect there's a variety of kids in this school that may have other underlying conditions that may make them more susceptible, but specifically calling on his peer group, if he's got a group of friends, especially if there's some of those female friends in the group that tend to be a little bit more, sensitive or sympathetic. But if just his small group, would get on board to support him, then it's, making him stand out a little less if other friends are doing it as well.
I can
Thank you.
add, if I may, from a previous experience, we had offered as our clinical team to go to the school. So maybe the physician or nurse practitioner or even a nurse can try to do it in educational way to the school, have talk to them and go talk to the class or even larger group, so it can normalize and explain that tend to empower them, the student, because sometimes I don't know if they will share their background medically with the others or not. That's why they don't want to wear a mask, to say they want to go back to normal. And I feel that, and I appreciate that feeling that they want to have back. But we can try to help, and that seems sometimes with other conditions, to help the school understand and the classmate understand.
That's a really good point. Sometimes with that education allows other kids in the class kind of rally around that student if the student is open to others knowing that that's who they're talking about. Of course, the physician or nurse practitioner, whoever is going in and doing the education, doesn't necessarily have to call out who the patient is, but if they do call out who the student is with the condition, sometimes it does empower other kids to kind of rally behind and support. And they may, we might see kids wearing masks in support too. So that could always be another option. And then just education in general is always a positive thing.
Thank you all so much. Dr. Hanna, this is for you. What is the definition of immunocompromised?
It's a very, very good question. I can give the CDC answer, which has some 4 categories of this patient. So anyone who had transplant in the last 2 years, any patient who is on chemotherapy or immune suppressive therapy, any patient who got solid organ transplant, or sometimes other patient who got biological treatment for other autoimmune diseases. So, and they really left the door open. They said that patients sometimes could be other congenital or anatomical or other causes. So what I'm going to translate to our patient group here in aplastic anemia, I will say any patient who is on immune suppressive therapy or got ATG, they are immunocompromised for at least a year. So they may not, even if they finish the ATG, these cells, they are going to be new. They have not been educated. They haven't finished their thymus school semester. I always tell them, you need to be careful. If they are on cyclosporin or other immune suppression, that's no brainer. If they got a transplant, even if they are off immune suppressive therapy, they are still considered immunocompromised until 2 years after transplant.
Thank you. This question is for Dr. Hanna again. Have you seen any negative effects on blood counts or otherwise for patients receiving the vaccine? And how do you recommend monitoring for such effects?
Very good question. So I think the data is not complete. I would be honest with you, and there is some case reports. Patient who got who have PNH when they got the vaccine, we see sometimes increased hemolysis. Also, patient who have a plastic anemia, we see sometimes report couple of two case reports that there could be what's called relapse or worsening of their counts if they have not achieved complete remission. But I have not seen anything if a patient is in a complete response and got vaccine that they will have any problem with it or they're affecting their counts. But if they are still having active disease, and that's back to why we put that distinction in the Plastic Anemia and MDS Foundation guidelines, it's really depending on where you are in your disease. If you are in a complete response or slash remission, you should be fine. It is that other category that maybe the vaccine could potentially have some a little bit effect on the counts because that vaccine may trigger your immune system and you may have a little bit more hemolysis or gradual temporary effect on the counts, but it is the benefit could outweigh the risk of having the vaccine. But that's an individual decision that need to be decided with the clinician based on where you are in the therapy and what it is the risk of transmission to you.
Thank you. This question is for Dr. Eshleman and Taylor. This question is regarding siblings. The question is, our daughter is getting ready to enter her senior year of high school. Her younger brother is almost a year out from transplant. She's having some reluctance about potentially going to school and bringing home something to her brother, which she knows could be very problematic for him. How do we help her with her going back to school and knowing that we can help keep her brother safe? And by the way, she was his donor.
I would say first, congratulations on raising such a thoughtful young lady, who's thinking of her younger brother when she's entering such an important part of her life. I think going back to calling on the medical team and just providing that reassurance that, if the trusted team member is making a recommendation or kind of providing that guidance, that kind of providing that reassurance that it is okay. And then I would also kind of talk with her about what she feels comfortable with, so there are things that, what would help her feel more comfortable. Maybe there's preferential seating in the classroom, even where she's going to be, further apart from other peers, or, eating lunch in a smaller area. Are there things that might help her feel more comfortable returning to that setting and allowing her to participate in these activities?
Taylor, did you want to add anything to that?
I think Dr. Eshleman said it very well. I think she's very thoughtful of thinking of this. I know it's very complex, especially being his donor, but also just with all of that, just ensuring that you're doing what you want to do too, with balancing what's medically appropriate. So just calling on the medical team to get that reassurance. And like Dr. Eshleman said, if there's any additional accommodations that can be made to help feel a little safer at school, totally do that, because you shouldn't have to miss out on your senior year if possible, if you can avoid that.
Thank you. And this question is for Dr. Hanna. We're getting ready to start vaccines for my child for transplant. Is there a timing of when we should incorporate the COVID-19 vaccine with starting the vaccine series? Is there a timing that we should look to do that?
Very good question. So I will honestly start with the COVID vaccine. In the past, CDC did wanted 14 days separate from others, but they waived that guidance. They said now it is okay for children and adults to get co-administration of COVID vaccine with other approved vaccines. So there is no contraindication to really get the COVID vaccine with others. My practical advice for the families right now, try to give it at least on a separate day. So it's not on the same day. So in case the patient develop any side effect, so they will know if it is due to the COVID versus others. So it is important. Two, the COVID risk right now, it is higher than the other infections risk. That's why I all tell them, start with the COVID vaccine. It is more important, but don't delay the other one too. Give the COVID maybe next week or 2 weeks when you come get the other vaccine too. But it is at least know it is safe to be co-administered with other vaccines.
Thank you. This question is for Taylor and Dr. Eshleman. It's in regards to a patient who has not had transplant. They've done fairly well on ATG. Counts are not great, but certainly not a need to go to transplant, and they've maintained okay counts for the last 3 years. So the question is, my child does not really like to talk about her illness, her treatment, or just in general, move on with life. And we've tried talking about going back to school and the safety for her, does not want to talk about it. Any suggestions on how we can start those conversations and make sure that we're not missing something with any potential anxiety? Or just how do you start conversations with somebody who really does not want to talk about it, but you need to have those conversations?
We're both like playing like rock, paper, scissors here. So I don't know how old she is, but I think sometimes it's okay if they don't want to necessarily talk about it. And maybe I know it's hard sometimes as parents that they may not want to talk about it with you, but they may have another person that they feel more comfortable talking about certain things with. So if they have another identified person that they feel comfortable talking about certain subjects with, if it's going back to school, maybe it's their friends, maybe it's a support person at the hospital that they identify as a safe person, maybe allowing them to have that space, or maybe they have other ways of processing or expressing. Some kids rather draw or write or paint or do other ways of processing through their emotions. So maybe that's something that you can work through together with her to allow some expression of her emotions that may not necessarily be talk processing, if that makes sense. But you can always talk to her and maybe not always expect feedback, but just take those body cues too when she's over it, because she may not want always to talk.
Yes, I agree. I think that not everyone is a talker, which for those that know me is very hard for me to understand because I am such a talker, but that's not how everyone copes. And so I think the goal is really creating opportunities for those conversations. And this isn't just kind of specific to the diagnosis or to COVID, but, getting in the habit of asking questions in the morning, what are you looking forward to today? In the evening, what was the best part of your day? Did anything funny happen? So just creating opportunities to talk about everything so that the children know that they can come to you if there's something they want to talk about. And then certainly checking in and asking how she's feeling about this particular thing or asking if she wants to talk. But if she says no, the answer is no. And I think to Taylor's point, people engage in different activities, so whether it's listening to music or art or even, doodling on her homework, it may be coming out in other ways, or maybe she's talking to other people, and that's okay. I think too, your point about, well, how do I know if there's anxiety or something else present? I think looking at other behaviors. And so we always kind of encourage watching for changes. So if you see changes in eating, changes in sleeping, just kind of changes in attitude, or just other changes in behavior, that's something to that will perk your ears up. And the thing that we know we need to be careful with these kids is that it may be related to diagnosis and treatment, or it could be related to friends or boys or whatever it may be, because these kids are going through their typical life in addition to this atypical experience. So we want to be careful not to misattribute if we see something like that. And finally, I think, your comment about, in general, she hasn't been open to talking about it, which is fine because that's a choice. And when it comes to school, assuming she's going back, again, maybe it's not a choice because we have to plan or problem solve. And so just making sure she knows, like, I need to hear from you about, how you'd like to approach this. And if she isn't interested or willing to do that, then just letting her know that then, like, you'll have to make decisions or you'll have to plan for it. And of course, again, I don't know how old she is, but you'd love her feedback for that. But this is something that's happening and we have to prepare for. So if she isn't able or willing to participate in that conversation, just recognizing that you and her other caregivers will be doing so.
Thank you so much. And Dr. Hanna, this question is for you. This is from a fairly newly diagnosed family, and they're not needing transplant at this time. Counts are stable at the moment, but they know there may be a possibility of transplant in the future. With COVID cases on the rise, at what point do you delay transplant because of the risk of COVID?
That's really a very important question. We last year struggled with that question because one, there was a little bit of short supply at some point of a blood product, so we were not sure if we take a patient to transplant, if we have enough. Two, with the hospital resources, whether that units or BMT unit would be available. So what I always answer is two pieces. First, I think if the patient needed transplant, then medically better to go to transplant and not delay that. But the second part that it is important is the healthcare team and is the hospital will be able to meet the requirement and be able to take care of that patient in timely way. It's not the team is getting deployed to go to other places, etc. So those are the factors that need to be discussed individually, but better, I would say, to take that patient to transplant, because the risk of COVID is going to be the same. If a patient is going to need a transplant, that means that they didn't respond to therapy. So they are going to be immunocompromised. And taking them to transplant, at least they're going to be in the hospital. Doesn't mean the hospital is in a safe place all the time, but it is at least going to be really as much protection, and that be better for different reasons, different infection, to get the transplant earlier, unless that there is a systematic problem in that healthcare system in that region or others that make it just not safe or risky to do it because resources may be limited.
Thank you. And this is for Taylor and Dr. Eshleman. It says, my family has all been vaccinated, and we understand that not everyone, for various reasons, will become vaccinated. However, we've run into a situation where a few of our neighbors were having some back and forth about the contact with our child who is immunocompromised, and it's gotten a little sticky. Any tips on how we can best navigate the situation that we're occurring with communication? We don't want to offend anyone by not allowing our child to engage with their family, but we feel it's safety first. How can we, any tips for those conversations that we could help with?
Yeah, I would say, kind of back, and sometimes we're starting to repeat ourselves, but an education component, so educating the neighbors about the decisions that you're making. And I think too, it's this balance between, it's a personal decision, right? And how much information do you wish to disclose to them about your situation or your choices. But you know, to the degree that you're comfortable sharing that information about your choices and your decision, and giving them education about that, and then really ideally always direct communication. And again, I don't know the age of the child, so I think that makes a difference, but ideally keeping this between the adults in the situation, you know, as opposed to the children, and just being really direct with your communication and your wishes, and you know, the reasons behind your choices, I think would be a good place to start.
Yep, I agree. And just being, gentle with yourself and knowing that you're doing what you need to do to keep yourself safe and your child safe. And I'm sorry that you're having to go through this, because at the end of the day, you just need to do what you feel is best for your child. And this is just an added stressor right now. So I'm just wanted to add that. And but I think just the continued education of why you're doing it is because of safety. It's not because you are judging them because of a personal choice. It's because you're doing it because of safety.
I think
Thank you.
one other thing to, sorry, to add
Sure.
just too is, you know, I think this is hard for all of us to remember, and especially kids, but that this isn't forever. You know, ideally that this is going to be a time limited, you know, experience. And so that, you know, hopefully one day soon we'll get back to those kind of more typical activities, but just trying to keep that in mind as well, which is sometimes helpful and sometimes not, but.
Thank you. Dr. Hanna, this question is for you. My child has received first and second vaccine and did pretty well. However, did have a drop in counts. We're a little nervous about getting the booster. Any advice? Have you had anyone that's had the booster yet? And how did you manage patients who did have drops in counts, and are you recommending the third vaccine?
First, I'm so happy and proud of you and your son that got the vaccine. So I think that's the best way to protect. Given that really that your son did has a drop in their counts, I would refer you back to talk to his hematologist to see how severe and if the counts start to normalize again, because we expect their drop to be temporary before you decide about the need for the boost and whether that boost can be delayed. So that need to be maybe more patient specific. In terms of my own experience, I have two patients who got boost already, but none of them were aplastic anemia or a transplant. I have one BMT who's getting boost this week, so but it was not for an aplastic anemia indication. So hopefully within this month or early next month, we'll have more data, and the CDC is observing and monitoring very closely of any potential side effect. But from previous studies that have been published, really doesn't seem to be any increase side effect with the third vaccine or the boost.
Thank you. Dr. Hanna, this is for you again. This comes from a parent whose child is 19 and was recently diagnosed, but diagnosis of aplastic anemia came after the second vaccine. Is there a connection between the COVID-19 vaccine and a diagnosis of aplastic anemia?
Very good question. So we don't know. There is one case series from Dr. Young that published about 5 patients. One of them was diagnosed at the same time with aplastic anemia and COVID. I think given the millions of cases of COVID we have seen, we have not seen a pandemic of aplastic anemia. It is in somewhat assuring, but biologically, physiologically, we know aplastic anemia can be what we call it idiopathic, and it could be an immune response to something triggering our immune system, either an infection or others. And it is possible. I can imagine that happening after either a vaccine or an infection. So that's really what I want to remind people about. It is could be also coincidental finding. It's hard to know uh, the clear association, and that was the comment and the discussion in that publication about the case when it was diagnosed with the COVID infection. That was not a vaccine related. Um, and I cannot really know for sure, but it's important to report that to the CDC. That's part of their safety monitoring. So they can then look if there is more cases of this reported, they can monitor and see, is this more than the general expectation of incidence of aplastic anemia? And we have not heard any of that from the CDC, which monitoring really, and when you get the vaccine, you're getting a card and you get a text message on your phone. It comes a reminder from the CDC if you have had any complication or any problem since your diagnosis. So I would encourage you to register your child in the safety database in the CDC so they can track that, and we will find out if this is more reported or not.
Thank you, Dr. Hanna. This question is for Taylor and for Dr. Eshleman. How do you know the difference between normal anxiety and anxiety that you need to seek help for your child?
I think clinically, from a diagnostic perspective, that to make a diagnosis, oftentimes one of the criteria is impact on functioning. And so that is definitely kind of a marker I would look at is, are these thoughts and feelings, impacting the child's functioning? And I always look at, the things that they want to do or the things that they need to do, because maybe homework is hard, but they can still go play with friends. But you still have to get homework done. And we want them to go play with friends, assuming it's safe and appropriate. So looking at impact on things that they want to do and things that they need to do. And again, looking at those changes, which, I kind of look for patterns. So trouble sleeping one night is not a big deal. Trouble sleeping nights on end, or if the trouble sleeping is meaning they're sleeping in class during the day. So kind of really looking at those things, I think that is the diagnostic criteria. But that said, if the child is feeling bothered by the feelings, so yes, I'm going to school, I'm doing my schoolwork, I'm spending time with friends, but I'm still really feeling anxious, I'm biased, but I think it's always helpful to seek help. And that can be starting with the pediatrician, just for some reassurance, either for you or the child, reassurance on what is typical or not unexpected, versus, meeting with somebody to either get that reassurance or learn strategies to manage those thoughts or feelings.
Oh, thank you, Taylor.
Yeah, I was just again agreeing. I think it's the impact on function, but if it doesn't feel like you want to take that necessarily, of course, I feel like anybody can benefit from seeking counseling. But if you don't want to take that step, maybe implementing some additional coping skills at home is always beneficial. So talking to your pediatrician is a great place to start if you feel like that could be beneficial.
Thank you. Dr. Hanna, I'll see if maybe you can help with this one. It says, as a parent of an aplastic anemia survivor in the South, we're having a difficult time with people understanding why both parties need to wear a mask. Is there some medical information that we can share with friends, families, and school administration? There's a lot of misinformation and resistance to mask in their area. Is there somewhere maybe that they can go, whether it's the CDC, FDA, any recommendations you have?
Thank you so much for the person who asked this question. It is really quite important, and I feel torn about it as a physician, as a pediatrician, as really a human being. I feel that we need to do everything possible to protect human life. At the essence of our freedom, it is the life itself. And it is important to do that, especially in time of uncertainty. I think the science and the physician are truly doing their best with an unprecedented pandemic to get information to the public as much as possible. And I don't know of any website, any fact specific that would be enough to convince, because this is honestly not only South. We have that problem even here in our community. And I don't want to label it in anything. It is unfortunately has been our environment, cultural environment, our political environment, for whatever reasons, this became a dividing issue that should be unifying us, trying to do whatever possible. It is all additive effect. There is no one thing going to protect you from the COVID, period. Everything will help. Vaccine helps the most. That's the most important message that people need to know. After that, social distancing can help, and mask will be an additional things. And the data, it is going to be, people can look into it and divide and look, this is one study and this other study showed that. There is no percentage that it will tell you because each patient can be different. What I say to my families and my patients that they are struggling with the idea of why mask is important is we're really trying to do everything possible. We need to be on the careful side, and we don't want to be in a situation when we regret the chance that we are able to do it. The hardest thing about COVID-19, the hardest things is the unpredictability. I have young people who are in the 25 who died from COVID, and we have 60, 70 years old who had cardiac problem who may who survived COVID. We don't have crystal ball, and that's why it's sometimes hard. And some community and some people belief are being affected by their own personal opinion. They will say, oh, that person survived COVID, it's not a problem. But I can give you thousands of cases that it is on the other side, people didn't survive COVID. So that's my message. It is a message of empathy. I want to really go to the humanity of that person more than just to go to their heart more than just their brain. Because despite I am a scientific and I can give you facts, we can refer you, which I believe the CDC has a wonderful website and talk about all of the data. That's the source of truth that I will go and refer my patient to get most up-to-date information, because sometimes things change. Go to the CDC website. That's really is the best website for information. But beyond just the fact and the number, we are all human and we have a shared responsibility toward the community. No one gonna be safe until all of us are safe.
Thank you. And this question is also for Dr. Hanna. The question is, all of us in the family have been able to be vaccinated. However, our youngest, who is the aplastic anemia patient, is too young to be vaccinated. Should we be taking extra precautions inside of our home to make sure that we are not inadvertently transferring or bringing home the virus and unknowingly giving it to our unvaccinated aplastic anemia child?
Very, very thoughtful question. Really important, but I would say the balance of the benefit and the risk overall together, it's okay when you are at home to be at home. No need for any extra precaution in terms of mask or social distancing. I think if you are vaccinated, that's the best you could do, because that could decrease the risk of transmission. It doesn't eliminate it. The other thing, when the boost becomes available for the healthy young people, try to take that boost. And the expectation, it's after September 20, that would be the recommendation for people to get the boost 8 months after their second vaccine. So that would be your best chance to take to protect your youngest son. And if you have a symptom of a cold, try to get tested quickly and be in isolation or quarantine until you know the results. We really are, the disease can manifest in a very mild cases and people may underestimate that. So from a headache to any runny nose, get tested. And that way also you could protect your youngest child.
Thank you. For Taylor and Dr. Eshleman, any other additional advice for parents who are navigating the going back to school and their kids getting into normal activities like playing with friends, sports, all of that? Any additional advice that you'd like to give that are helpful for parents getting back to normal things with their kids?
First off, just keep reminding yourself you're doing great. It's been a really, really hard year. And then you also are adding on top of that an ill child. And just give yourself grace and take some time for yourself. I know it's hard as a parent to ever set time away for yourself, but even if it's, you know, a few minutes out of the day to do so, but just remind yourself you're doing great. Additionally, I can't recommend grounding techniques enough. You can do those at any point during the day, even if it's just deep breathing or something called box breaths is something hold on. Okay. It was very loud where I was. Working in a hospital. So, or like downloading things like Headspace or Calm to provide guided meditation, things like that you can even do at bedtime, or, you know, you always have your breath on you, because sometimes we forget to breathe. I mean, even my Apple Watch it reminds me, because as humans, we're really bad at that. So something as simple as that, but remind yourself, you've got this, you're doing great.
I absolutely support all of the coping techniques. You know, I think the other thing is and again, a lot of this generalizes to everyday life outside of an illness or a pandemic, and acknowledging that everything we talk about is much easier said than done. But preparing, you know, getting prepared. So if it's the first time back to school or a new school, you know, can you drive around or, you know, walk around the school and see what it's going to look like, whether it's open or not? You know, can somebody from the school send you pictures of what it's going to look online, what it's going to look like online, or what the classroom is going to look like? You know, in advance, maybe can you get a list of peers? Can the teacher help you connect with one or two peers prior to the beginning of the school year, as soon as school starts? You know, just to take those steps to reintroduce things to increase the comfort. And then I think too, having a plan in place for like the what ifs. What if I don't know anyone? What if, you know, I start to not feel well? What if the kid next to me coughs? You know, and of course you cannot prepare for everything, but just to have a plan in place, because I think a lot of times, even if we don't use that plan, it helps kind of alleviate any of that anticipatory anxiety about, well, what will I do if this happens? Well, if it happens, that this is what we'll do. And so I think just trying to prepare, reintroduce things as much as possible. You know, if we're signing the child up for soccer, do we get a play date with one of the kids on the team prior to going to practice? You know, just to increase everyone's comfort entering these kind of new situations again.
Thank you so much, Dr. Hanna, Dr. Eshleman, and Taylor, for sharing your time, your expertise, and all the great advice for everyone today. We certainly are in some challenging times for everyone. So if you'd like to watch this webinar again at a later time, it will be available on our website within 2 to 3 business days. If you have any additional questions, please feel free to send it to us in 3 ways. You can send an email to help@aamds.org, call our helpline at 800-747-2820, extension 2, or submit your question on our Facebook page. On behalf of the Aplastic Anemia and MDS International Foundation, I'd like to thank you for joining us today, making us your resource of choice for information on bone marrow failure diseases. Our medical advisory board and team are always here to support you and your family, as we've done for the past 37 years. This concludes our program. Thank you again.